Good afternoon. Welcome back to Mobility's Life. Last time we discussed something about osteoporosis in the first part. Now we will be discussing it a little bit more further in a little bit more detail. What are the clinical features of osteoporosis? What does the patient complain of? Unfortunately, osteoporosis mostly is a silent disease. That is, the patient does not have any definite symptom to talk about. Yes, a diffuse body ache, back pain can be a feature of osteoporosis, but it is not very consistent. But elderly people who are developing a stooped posture, cannot stand up straight, or their height is decreasing, these patients we can always suspect to have been developing osteoporosis. Also, another thing which alerts us about the development of osteoporosis is fracture on a trivial injury, like a patient just falls down and breaks the hip or the spine or the wrist or the shoulder. These are the locations where a trivial fall, a trivial injury developing fracture is almost a diagnostic feature of development of osteoporosis. Again, but for quantifying osteoporosis, we will require to do a bone mineral density test, a DEXA scan, by which we can ascertain whether the patient is osteopenic, that is a weak bone, osteoporosis, or a normal patient. So in case of a osteopenic patient, a patient with weak bones, we can treat the patient with vitamin D, calcium, healthy lifestyle, good quality food. But if the patient has already developed osteoporosis, in that case, we will have to treat the patient with specific medication to halt the process of osteoporosis and sometimes reverse the process of osteoporosis. There are weekly tablets, monthly tablets, yearly injections, daily injections, 6 monthly injections. A variety of regimens, variety of medicines are available. But the most important cornerstone of osteoporosis treatment is prevention of fractures. Prevention of fragility fractures is the cornerstone of treatment of osteoporosis, by which that is the way we can actually stem the rot that has caught onto the person. Thank you and God bless you. See you again.